I'm Katie. I just wanted to give you a little talk today about some things that are very important to me. But first, let me start where it all started. I went to University of Scranton. I graduated in 2002, and I can't say enough good things about it. I'm one of those crazy people. I love to talk about my undergrad college. After that, it actually set me up on a perfect path. I was able to continue and do dental school at University of Pennsylvania. Then I actually was a full-time general dentist in the Navy for 5 years. After my time in the service, I was able to go back and do my PEDS residency at CHOP, Children's Hospital of Philadelphia, and University of Pennsylvania combined program. And that's kind of what set me up for today. I am a pediatric dentist in private practice in Lansdale, Pennsylvania, and I've been practicing for about 6 years. So I just wanted to kind of introduce myself first, but I also wanted to talk a little bit about what I do, why I do what I do, and also kind of some implications that might be able to help you in your daily lives. While I was at CHOP, I was able to design and implement a research program that looked specifically at breastfeeding and also dental decay, and kind of really interact with mothers while I was there. My research article is called Breastfeeding, Co-Sleeping, and Dental Health Advice. I was able to publish it in the American Journal of Maternal Child Nursing in 2015. So what I want to just explain today is a couple basics to you first, and then we're going to go into my research just so I can explain kind of my passion that I like to share. So when we start talking about dental decay, we want to learn about the basics. What causes decay? When we look at this, the basic way that we can look at it is look at these three circles here. There's three interconnecting circles that cause cavity. It's a multifactorial process, just like many things in medicine. It's not so simple as to say, well, A equals B. We have to have kind of all these perfect things coming together to form a cavity. So obviously we have the tooth, right? The host. You have to have a tooth to get dental decay. The second factor, the other kind of interlocking circle, is the plaque. The plaque is where the bacteria sits. So that bacteria is kind of harbored in that plaque and it's held against the teeth. The last circle, and this I even venture to say that this is one of the biggest factors in pediatric dentistry especially, is the diet. So with the tooth, the plaque present, and then the diet with sugar or fermentable carbohydrates in it, we now have the perfect situation, those interlocking circles where we get a cavity. And I'll go into more detail with this. But the two bacteria that have been identified kind of most commonly in dentistry as causing dental decay are Streptococcus mutans, and Lactobacilli. What happens is these bacteria actually go on to metabolize fermentable carbohydrates. When they do that, the process helps to produce demineralization and cause a cavity. So without getting too dental nerdy on you, I do want to show you one thing that we really make a big deal in dental school about. It's called the Stephan Curve. This Stephan Curve is extremely important to understand as a provider, but also as a patient. What you see on the Stephan Curve is there's all these little dips, and those dips occur when you eat. So the pH of the mouth is about neutral, about 7. When we have someone eat, you can see in the illustrated Stephan Curve that I've shown you, that little dip goes down as the person is enjoying their meal. The dip goes down below 5.5, which is named the critical pH of the mouth, and it usually dips, sometimes into the 4.3 area. But then on its own, over time, about a half hour, the mouth kind of restores that neutral pH again. What I want you to notice is that each time you eat something, that dip occurs. So if you're eating 3 meals a day, it's going to be 3 dips. If you're eating 6 times a day, it's a much different story. One of the things that I really want you to pay attention to is where you see that snacking area at the end of the curve that I'm showing you. That snacking area, you see that the patient in this case was snacking for about 45 minutes to an hour while sitting on the couch eating some Oreos. And what happened is that dip, that pH dipped down to the danger level and it stayed low for that whole hour. When the pH is in this low level, this is where demineralization occurs when a patient has fermentable carbohydrates in their mouth or acidic liquids or any type of sugar when there's a bacteria on the teeth. So let me say that again. When there's bacteria on the teeth and you have fermentable carbohydrates, sugar, or an acid in the mouth, it dips that area, that pH, lower into the danger zone, and that's when you have demineralization. And you can see that it really depends, the pattern depends on what you're eating and how often and for how long you're eating. So what can we do about this? I mean, you're going to eat, number one, right? You're going to have carbohydrates, at least most people are. So what can you tell your patients to do? The two biggest things that we already know that, the general population would know easily is, okay, brush your teeth, right? Improve oral hygiene. So we want to brush and floss. Flossing is key. If you're just brushing your teeth, you are only getting the surfaces on the cheek side and the tongue side. You're missing completely, in between the teeth. It's a really gross story, but I have to share it. In dental school, a professor explained it like this, and I can't get it out of my head, and it gets me to floss every single night. It's kind of like taking a shower. If you took a shower and just washed the front of your body and the back of your body and didn't wash under your arms, that's what it's like without flossing. Would you get out of that shower and feel pretty clean? Maybe for a day or so, not for so long, right? So you really want to make sure that you are flossing. It's the only way to get that bacteria out from in between the teeth. All of these other factors that I'm sharing with you really go into the diet. You want to make sure that you're snacking sparingly. When you are snacking, choose smarter snacks, limit the carbohydrates in the snacks. So things like cheese stick, yogurt, a low sugar yogurt would be a great option. Even nuts, things like pretzels, Cheez-Its, straight up sugar obviously are not the great option. You want to drink water if at all possible, especially in between meals, because that prevents that dip into that danger zone. And it also helps to clean the teeth off as well. When we do choose juice, or as adults, those fun coffee drinks from Starbucks, we really want to limit them and also be smart about it. If you choose to give your child juice, they should have it for a small amount of time, 10, 15 minutes with a meal, and then they're done with it. The worst thing that anybody can do with a Starbucks sweet coffee with the syrup in it, or a child with a sippy cup with juice, is walk around and sip on it for 2 hours. It just lengthens that time, like we saw in that picture, in the danger zone. We also want to avoid gummies and gummy fruit snacks. So sugar is bad, right? We know that for teeth. Sticky sugar will stick there until you're able to clean it out, possibly that night. And something that I always tell parents, I'm a pediatric dentist, okay? I have a 4 and a 2-year-old. Can I guarantee you that twice a day I'm brushing their teeth perfectly? No. Because let me repeat, they are a 4 and a 2-year-old. So there's, I absolutely do my best, and I am a little crazy, so I do pretty good. But one of the things is that they're all over the place sometimes, and you can only do the best you can. So even with knowing what I'm doing, sometimes I'm not 100% confident I'm getting everything off their teeth. So by choosing these correct stepping stones, we're able to set them up at least for a healthier mouth going into that. So if we have all these prevention tips, why do I see this every day? This is called severe early childhood caries, or it used to be termed baby bottle caries, baby bottle decay. And what it is it's this widespread pattern of decay across the front teeth and including the back teeth as well. Many kids get a cavity here or there. This is a different situation. This is widespread, and it's very early on. The child in this picture is probably about 2. And what we see, the most 2 common causes for this is going to sleep with a bottle that contains milk or juice, or second, ad-lib breastfeeding throughout the night, specifically with patients that are co-sleeping. We see this more likely. So this is where my research comes in and my true passion. This is something that I feel so passionate about because as a healthcare provider, and I know that you know this, we want to encourage breastfeeding, right? I mean, there's so many things right now that help with breastfeeding, baby-friendly hospitals, and we've kind of swung the pendulum to the point where we are really encouraging patients to do this, which is great. I don't have to list the benefits of breastfeeding to you. That being said, can it be harmful in some cases? In some cases, we have to look specifically at what the patient is doing and help them to tailor it a little bit differently. Because the last thing I want to hear, like I've heard from patients that come to me over and over, is that they were told at 6, 7 months, well, now the kid has teeth, you have to stop breastfeeding. That's a shame because we know the AP guidelines are for longer than breastfeeding up till 6 months, right? So we want to encourage that relationship, but we want to do it in a safe way. So breast milk karyogenicity, or the ability to cause cavities, is highly debated in dental literature. Most dental literature says that it is less cariogenic or cavity causing than bovine milk. Some dental literature actually says that it's not cavity causing at all. So that's good news, right? Well, the thing that's really important, and all studies agree with this, is that breast milk in the presence of a carbohydrate-laden plaque sitting on the teeth becomes cavity causing. So again, remember, I just told you, do I brush my 4- and 2-year-old's teeth perfectly every night? Again, I try my best. Could there possibly be some plaque hiding in there? Possibly. So is the average mother with, a 1-year-old that's screaming and writhing, are they brushing their teeth perfectly? Possibly not. I can give them tips, and I'm happy to do that. I show them positions and I show them techniques to help them. But life happens sometimes. So you want to make sure that by encouraging them to get as much plaque off of the teeth as possible, you're really setting them up for less chance of dental decay, especially if they're breastfeeding frequently through the night, especially if they're co-sleeping. So co-sleeping, why is that so important? Co-sleeping encourages more frequent nursing throughout the night. So whereas if a child is in their own room or even in a safe co-sleeper off to the side, they may be more likely to have more kind of regimented nursing sessions, if you want to call it that, in those early years. The mother may get up and it's more of like a formal nursing session. The child goes back to sleep, they go to bed. 3 to 4 or so maybe during the night. Obviously that ranges. But with co-sleeping, what can happen is the patient is sharing the bed with the child. So typically they are able to latch on and nurse, get to the breast the entire night. So what happens is the average is about 7 to 10 nursing sessions a night. And what's different about these nursing sessions is a lot of times they're for comfort versus just nutritive, which again, helps the baby sleep, right? But the problem is when we have this, we increase the frequency of the nursing sessions, we increase that length of exposure that breast milk is pouring on the teeth. And the other thing that's important is the latch can change. So when we encourage breastfeeding, we encourage that deep latch, correct? The nipple should be all the way back into the back of the mouth, almost up to the throat because of the deep latch. But I want to show you this. In co-sleeping babies, if it's more of a comfort suck versus a nutritive suck, we tend to see a shallower latch, almost like a pacifier latch. And what happens then is not only do we increase this frequency, we increase this length of exposure, we now are actually literally bathing the teeth a little bit more with the milk than if it was a truly nutritive sucking position. And you can see that in this picture here. So what can we do about this? It's overwhelming, right? I support it and I follow the AAPD and the AAP guidelines, and I know that is to not encourage co-sleeping. I don't encourage co-sleeping, but I also know that it's the real world and some parents choose to do that. So while I would be encouraging patients to have separate beds or separate safe sleep spaces, I would also want to have a conversation with them about what their sleeping arrangement is. It's a little awkward, but it helps to kind of tailor these responses to them a little bit better. So all mothers can benefit from specific oral hygiene instructions. We need to let them know by removing that plaque adequately, it really helps to set the child up for a much less of an issue with dental decay in the future. I never want to shame a mother for breastfeeding. It's hard, it's emotional, it's painful, it's a personal decision. I want to help them make that choice, but in a smart way. So the thing that I found interesting in my study was that less than 50% of mothers in my study actually readily shared their sleeping arrangement with their provider. And that was because of the stigmas of co-sleeping. And a lot of them, their answer was that they just didn't want to hear it. And on the flip side, less than 20% of healthcare providers actually initiated that conversation. It's awkward. What I try to do is I try to stay very neutral. I would give the recommendations of the AAP, but then I would also say, if you are choosing to bring the child into your bed, these are some tips that I want to give you. If they're nursing more than 3 or 4 times a night and they're staying latched on for 30, 40 minutes at a time and falling asleep at the breast in the bed, these are some tips I want to tell you. Something even just to give you another picture, if the child's falling asleep in the bed after nursing, they often have milk pooling in their mouth versus if you were to be up and putting them back in a crib, they would be swallowing that. So that's another thing to just kind of visualize that, you want to be able to tailor your recommendations to these parents. So pediatricians and other healthcare providers get a great opportunity to see these parents, these mothers, early on, a lot earlier than a pediatric dentist does. So I would encourage you to initiate the conversation with the mother. I would encourage honesty. And I would evaluate the baby for some of these high-risk behaviors. If you see these high-risk behaviors, or if you see anything that you're concerned with, some demineralization on the teeth, something just doesn't seem right, send them right to the pediatric dentist, of course. You can give oral hygiene anticipatory guidance specifically tailored to mothers that are breastfeeding. And it's not so much that we want to encourage them to brush their teeth every time the child nurses. It's all about setting up that plaque-free tooth before we even get into the bed. So this is always about like the 6-month range where they start with the puffs and the crackers and all those things, the bananas. That's where we kind of enter this area where we have to be a little bit more careful with our recommendations with brushing and the setup as we're going to bed. And last but not least, encourage the establishment of a dental home by the age of 1. One of the best things that we can do for these parents is help them together set up healthy habits early on. I know as a parent, you know, if you told me now that I have to change everything I'm doing with my 4-year-old and the whole way I do things, that's overwhelming. It's really overwhelming. If you got to me when he was 9 months or even 12 months and said, these are 1 or 2 things I'd really like you to kind of focus on and change, much more doable, and a lot easier because he wouldn't really notice the change as much as he would when he's a spirited toddler. So together, dentists and healthcare providers can really help to educate mothers regarding oral health. Here's my contact. This is a very open dialogue, so if you have any questions, if you'd like a copy of my research, or any concerns, please feel free to email me and reach out to me. Thank you so much. Thanks for listening to me. Take care.